Alright, this is my lab partner's client release form. Alrighty, doctor's orders are to come into patient room, perform a physical assessment, assuming a health history has already been taken as part of the procedures. Knock knock.
Come in. There's no rush hour going north.
Hi, how are you doing today?
Good.
Excellent, excellent. Providing privacy and washing hands. My name is Patrick. I'm going to be your student nurse today. We're going to be running a physical assessment from your head, cranial nerves, down to your cardiovascular system and pulse. Before we get any of that done, though, I need to verify your patient info. Can you state your name and date of birth for me?
Kayla Narcissus, 10/2092.
All right, that is all in order. Excellent. Height and weight taken, 5'4", 160, health history already done, curtain armband, all that checked. I'm going to start with vitals. I'm going to go ahead and check your pulse.
Oh, Miss Morgan, I sent you an email back from what you sent to me. Did you see it? I don't know. I haven't checked. Okay, I'll check. That's how you know we're in the middle of nowhere. Can't get any service out here.
You can't in this room.
Really?
Really.
Not even Wi-Fi? No, I can't find Wi-Fi either.
No, I don't think so.
If the Wi-Fi doesn't work, we're gonna have a problem.
Alrighty. Your pulse rate is at 76. Your respirations are at 14 a minute. So within normal ranges and all that. Next, I'm going to go ahead and actually take your blood SO2 levels real quick.
I really almost called her April when she was there. I was like, April. Don't do that.
As I'm doing this, I'm going to go ahead and check the strength of some of your arteries here.
Yes.
Brachial artery +2, no frill. Temporal +2. Temporal +2.
You need something?
Carotid +2. Carotid +2. Alright. Alright, your heart rate here is saying 72. Your blood oxygen level is sitting at 92 as well. +2.
Well, I mean, no, I think it's going to be Fuji.
And +2. Alright. I'm going to go ahead and assess your blood pressure now. Do you have a preferred arm?
No.
Nope. Alright. It's out of the way.
Yeah. No, almost like it.
Yeah.
You're saying your professionalism.
Yeah. It was kind of quite unexpected.
Mm-hmm. 118/78, almost perfect there. What do you normally run at?
That's pretty much it.
Pretty much it? Spot on?
Mm-hmm.
All right.
Yes. I already have the grade. It's not gonna hurt. It's only gonna help me. It's not gonna hurt. Yeah, but I'd rather not be like a lot.
All right. I want to go ahead and check your capillary refill to see what your venous return is like.
If I went in there and they were like, what's the test on? I'd be like, I don't know.
Less than 3
I
seconds.
just know quiz 2. Professional.
that's it.
Less than 3 seconds. A-okay.
That's why I'm just trying to
And now I'm going to go ahead and palpate your scalp and assess your lymph nodes and check some of your cranial nerves. Real quick here, can you go ahead and smile for me? Scrunch your face about. Okay. Facial nerve is showing good responsiveness. I'm assessing your scalp here for any tenderness. Do you feel any pain?
No.
All right, very good. Showing symmetry, nice spherical shape. I'm going to test your lymph nodes. Preauricular, post-auricular. I'm here also just palpate the auricle. Any pain here?
Nope.
Nope, very good. All right, tonsillar, submandibular, submental. All right, and we're going deep cervical. And then posterior cervical. Go ahead and raise your shoulders. Alright, testing the accessory nerve. And swallow for me. Alrighty, so palpated the thyroid, tested vagus nerve 10 and glossopharyngeal. Can you stick out your tongue for me? Can you wiggle it back and forth? Alright, very good. Glossopharyngeal is showing up. Good. Good. Alrighty. So next, I'm going to go ahead and test your olfactory nerve. What I want you to do is close your eyes. I'm going to wave something underneath your nose. I want you to identify the smell for me. If you can do that now, close your eyes. And what do you smell? Okay, and on the other nares now?
Alcohol.
Alright, very good. And then that's what it is. So yeah, it's working fine. I'm going to go ahead and perform a whisper test on you. I want you to go ahead and occlude your right ear. I'm going to whisper something, and I want you to repeat back what I say at different intervals of distance, alright?
Okay.
So,
1. Green.
22.
22.
Alrighty, we're going to do the same thing. I want you to occlude your other ear this time.
4. 9. Kayla.
Alright, very good, excellent. Next we're going to go ahead and do a vision test. We're going to assume that visual acuity is in order a Snellen test conducted. Right now I'm going to test your pupillary reaction. I'm going to shine this light in your eye. You're going to see if both of your pupils will constrict consensually. So I'm going to go ahead and do that now. Alright, and on the other side as well. That's good. Alright. That tests the optic nerve, cranial nerve number 2. Next we're going to do a cardinal vision test, which will test the oculomotor, cranial nerve 3, abducens, cranial nerve 6, and trochlear number 4 cranial nerve. So what I want you to do is go ahead and follow my finger. We're going to form an H. We're going to move out to the right, up and down, and over to the left and up and down. I just want you to follow with your eyes. Up and down and over and up and down. We're going to come back to the middle and we're going to test for convergence. Just keep following my finger until it gets to the bridge of your nose. Alright, very good. Alright. Next I'm going to go ahead and look at your retina. Look at what's going on there behind the scenes in your eye. Here I'm assessing the macula, looking for accumulations of cholesterol, Dersons, or any otherwise abnormalities. It's showing good. Good vascularization, no abnormalities. going to take a quick sneak peek in your nose. Make sure that all the mucous membranes and everything are doing well. If you can look up for me. Alright. All is well with regard to that. This whole time I've also been assessing the patient's skin, showing good turgor, moisture, no dryness, no lesions, no scales, cracks, or other deformities. Alright, and now I'm going to take a look inside your ear to see your tympanic membrane. I'm going to make sure that it's looking healthy. Should be indicated. On that side, which would be indicated by the membrane being intact and of a pearly gray color, which we are seeing here. Very good. Now we're going to perform a sharp, soft test. What I mean by that is I'm going to go ahead and take this cotton tip applicator. I'm going to, in some instances, press the cotton tip to the side of your face, and in some cases I'm going to press the sharp end against your face. I'm going to close your eyes, I want you to close your eyes. I want you to identify which end I'm poking you with.
Okay.
Alright, so starting up here in the temporal.
Soft.
Alright.
Sharp.
Alright.
Soft.
Alright. Moving to the other side of the face.
Sharp.
Okay.
Soft.
Okay.
Soft.
Perfect. Alright. Forgot to check the periphery of your vision, so we're going to do that real quick. I'm going to wiggle my fingers like so. When you can actually see them on the periphery of your vision, let me know. Perfect. You have exceptional peripheral vision, might I say. Can you go ahead and open up your mouth for me? Okay. Stick out your tongue. Say ah. Hope if I have my light on. And assess under the tongue. Frenulum's intact. Nice moisture. Mucous membranes are intact. No lesions, sores, or anything of the like. Perfect mouth health. Alright, now I'm going to go ahead and assess your lung sounds. So I'm going to be checking sounds here in the bronchial area. Deep breath. Alright, normal. Then bronchovesicular, just here under midclavicular line. And on the other side. Alright, moving on to periphery, for vesicular, and to the other side. Alright, we're going to move around to the back and check out the back side. Examining the bronchovesicular region here. On the other side. Moving down to the vesicular areas.
And how long were you in here?
I was in here from
2 hours. Oh. 95 would have been fine.
Alright. I'm going to come back to percuss for dullness, but before we do that, I'm going to examine heart sounds. So examination of the aortic valve. Does sound well pronounced. Pulmonic valve. Herbs Point. S1 and S2 both audible at Herbs Point. Tricuspid. And mitral. They're going to percuss for dullness.
Aye.
Alright, I'm going to check for firmitis now, so I'm going to prompt you to say 99, and when you do so, please say it. So, right now,
99,
alright, and again,
99,
and again,
99,
and once more.
99.
Alrighty, showing bilateral uniformity and vibrations. We're going to do a chest excursion. I want you to take a deep breath in and out. Alright, showing unilateral expansion of the chest wall. Alrighty, and I think that just about wraps things up for us today. Did you have any questions, issues, or anything else that you wanted to discuss with the physician today?
No.
Actually, before we end this, I actually need to check your apical pulse. Alright, very good. Alright, I think that'll do it for us today. I'm going to go ahead and wash my hands here, but not with my stethoscope in hand. Alrighty, have a great day.
Thank you.
Mm-hmm.